How does our understanding of science impact how we treat addiction and how we think about and enforce policies?
Hmm. Well, the idea of having data-driven policy is a wonderful thing. Through decades of painstaking research, we have developed three, at least, completely different types of medicine that are able to help people with opioid use disorder stay clean. And these medications have been in use, at least one of them, since the 1970s. Unfortunately, these several medications are not widely available to people with opioid use disorder. For example, treatment programs for opioid use disorder tend to be located in cities. But most of America doesn't live in a city. They live in small towns and rural areas. And that can be quite a barrier.
So then where do we go from here from a treatment standpoint?
Well, there are several steps that we can take that would improve access to these several different treatments. We can invest in policies that remove, let's say, regulatory obstacles. When methadone got FDA approval in the early 1970s, our drug enforcement agency was very concerned about the idea that this was an opioid, which it is. So they established all these regulations that are required. So a person with opioid use disorder has to go to a federally and state and locally licensed clinic, and they have to go there every day to get that day's dose of methadone. These methadone clinics, they have to keep really extensive records and account for every milligram of methadone that they dispense. In other countries, like Canada, this kind of regulation doesn't exist. And so methadone is really much more available to people with opioid use disorder. There are also regulatory barriers to the use of buprenorphine. Buprenorphine is a wonderful medication that helps people with opioid use disorder stay clean. One of the many advantages of buprenorphine over methadone is that you don't have to go to the clinic every day to get it. You can get a month's supply from a qualified prescriber. Problem is, there aren't many qualified prescribers. So we do need to have some better data-driven policies around the provision of these medicines to help people stay clean. Another policy that until recently used to be a fairly significant barrier was the availability of Narcan. Narcan is this life-saving medication that can save people from opioid overdoses. You used to have to get a prescription in order to have Narcan. In many states across the United States, as a response to the opioid epidemic, the State Department of Health would issue a blanket prescription for all the pharmacies in that state in order that any resident of the state could go to that pharmacy and purchase the Narcan. And this saved countless lives. Consider this scenario. When a person begins to use an opioid on that daily basis, they start to develop tolerance. That is, they need a higher and higher dose in order to achieve that same euphoria. And pretty soon, they're taking a dose a couple times a day that would be lethal for you and me. And then let's suppose they get clean for a while and they have a period of abstinence. Let's say it's a month or two. And then they encounter some stressful event in life and they relapse to opioid use. But in the meantime, they've lost their tolerance and they go back to using their usual dose from 2 months ago, which is now lethal. And that's how so many people with opioid use disorder die. Having the Narcan available in the household can be life-saving. And so this is a policy that we've changed.
Yeah.
And so Narcan is much more widely available now.